How to understand vague lymphoma imaging results. Imagine sitting in your doctor's office, hearing that your scans show some unclear areas, and feeling overwhelmed. Vague imaging results can be confusing, but understanding what they mean is key to making informed decisions about your health. Imaging tests like PET scans, CORT scans, and MRIs are essential tools in diagnosing and monitoring non-Hodgkin lymphoma, but sometimes their findings aren't straightforward. Small lymph nodes or lesions might be hard to interpret because they can look similar whether they are benign or related to lymphoma. Inflammation or infections can also mimic disease on scans, making it tricky to tell what's what. Sometimes, after treatment, scar tissue can appear similar to active disease, adding to the confusion. When results are borderline or don't clearly show involvement, they are often labeled as indeterminate, which means more investigation might be needed. The PET scan, which uses a special sugar called fluorodeoxyglucose, has become the standard for lymphoma imaging. It combines functional information about how tissues use sugar with detailed images of the body. PET scans are more accurate than CORT scans alone because they can better distinguish active disease from scar tissue or inflammation. For example, PET scans have shown high sensitivity and specificity for detecting lymph node and organ involvement, making them very useful in staging and response assessment. Having a baseline PET scan before treatment is crucial because it provides a reference point. Comparing future scans to this initial image helps doctors see if the disease is responding to treatment or if there are new areas of concern. During treatment, interim PET scans are used to evaluate how well the therapy is working. The Deauville scoring system is a common method to interpret these scans. It assigns scores from 1 to 5 based on how much the disease lights up on the scan. A score of 3 or less usually indicates a good response, meaning the disease is likely in remission. Scores of 4 or 5 suggest that the disease might still be active, and your medical team may consider changing or intensifying your treatment. Understanding your specific score is important because it guides your doctor's next steps. Sometimes, imaging results can change the course of treatment. For some patients, scans may reveal more extensive disease than initially thought, leading to an upstaging of the lymphoma. This can happen in about a third of cases when comparing PET scans to CORT alone. Conversely, in rare instances, scans may show less disease, leading to downstaging. When results are unclear, your healthcare team might recommend additional tests, such as a biopsy, to get a definitive diagnosis. A biopsy involves taking a small tissue sample from the suspicious area and examining it under a microscope. This step can clarify whether the abnormality is lymphoma or something else. Communication with your medical team is vital when facing vague results. Don't hesitate to ask what the findings mean for your specific situation and what the next steps are. Your doctors should explain whether additional imaging or testing is needed and how confident they are in the results. If you still feel uncertain, seeking a second opinion from a lymphoma specialist is a good idea. It's also important to remember that, after successful treatment, routine scans are often not necessary unless new symptoms appear. Instead, follow-up usually involves regular physical exams and blood tests, reducing unnecessary radiation exposure and false alarms. If imaging suggests a possible relapse, understanding the context is important. Relapse rates vary depending on the lymphoma subtype, with some types like diffuse large B-cell lymphoma having a higher chance of returning. Detecting relapse early with imaging can help start treatment sooner, which often leads to better outcomes. Overall, vague imaging results are part of the complex process of managing lymphoma. They require careful interpretation, ongoing communication with your healthcare team, and sometimes additional testing to get the clearest picture. Remember, every person's situation is unique, and your medical team is there to guide you through understanding these results and planning your next steps. Always follow their advice and seek personalized medical care to ensure the best possible outcome.